Hi, my name is Sarah Hahn, and I'm a registered veterinary technician, an adjunct professor here at the Des Moines Area Community College in Ankeny, Iowa. And this video is intended for my students. Of course, anybody who is looking for a guide to what we're talking about today is welcome to watch it. But again, this is by DMACC standards, so it may not follow your program. Today we are going to go ahead and talk about how to restrain cats, especially those in both sternal and lateral. Just kind of reviewing what has been talked about in multiple lectures about head control, body control, and feet control. So the cat that I'm going to use today by choice is a very young, very active cat, so you guys can get a feel for how a lot of times we have to kind of evolve with our patients as their mood changes, as we figure out more about them, what they like, what they don't like, what they're more susceptible to responding to, all that kind of good stuff. One of the things I do want you to make sure that you have right off the bat for any kind of cat handling, honestly, is a towel. Now obviously if we're dealing with a cat who is having issues with oxygenation, so cats with any kind of heart disease or they have lung fields that are compromised in any way, we don't want to cover up their heads or anything like that because we want to monitor their breathing and their ability to oxygenate properly. However, covering the cat's head for our healthy patients can actually be quite helpful because a lot of cats will abide by the ostrich principle. They can't see you, it's not happening. Not true for all cats, obviously, so that's why I want to stress that it's important to evolve with the patient that you're dealing with at that time. So I'm going to go ahead and grab my patient. His name is Luther, and he is a 4 to 5 month old kitten. Very, very active, very excited to be out and about, very friendly. However, he's antsy, so we'll show you more about how to deal with him. All right, so this is Luther. As I've mentioned, he is our young, very active friend. So a couple of things about Luther. As you can tell, he's quite relaxed, he's quite comfortable, he's very curious. I do want you to pay attention to his body language. He's got his tail kind of up in a question mark. He's actively engaging with me. His eyes are bright and alert, but they're also kind of half closed. He's very relaxed. And I know you can't tell from there, but he is purring. So I know that that can obviously be a sign of fear or pain, but in this case, I do believe that it is a sign of contentment. He's just kind of overall a very amicable patient. So for Luther, because he's an active boy, he probably doesn't want to be held still. So when it comes to our sternal restraint, depending on what you're doing, a lot of times I tell people to kind of encase your cats in your arms, using your chest as kind of a barrier in the back. And then you're going to kind of push a little bit on top of their shoulder blades with the palms of your hands and kind of put just a little bit of pressure as you're rubbing and scratching and kind of easing them down. Some cats will lean into it and respond to it, and you just keep up that pressure until they're laying down. Other cats, you can put their feet out for them, and then once they're laying down in that comfortable position, you reassure them and continue offering them that positive interaction to go along with it. So at this point, if Luther needed to be in this position, I could back off. I like to put a hand on top of them so they don't think that that absence of pressure is an excuse to leave or move. And then if we were offering, for example, and obviously he's fighting this a little bit now because now we're holding still, I would go ahead and our squishy little active kitties may have to get a little bit more tight with when it comes to the restraint. So again, I'm going to lay him down, reinforce that boundary, and then I'm going to tuck the towel around him, and that just allows less of a chance for him to squeak out through the side. And then I would do something like put his head in a kind of a gentle collar. So what I'm doing is I'm supporting around the back of his neck so that I'm not compromising or touching his jugular or tracheal area. We don't want to make him feel like he's choking out. That will just increase his stress. So a lot of times I will kind of put them in a loose cat collar from the back and then put both fingers, 2 fingers on either side of his jaw, and pull my fingers to where there are little indents here, and that gives me control over his jaw. It's not something that I like to do for a long period of time. It can be uncomfortable for a lot of our kitty cats, but depending on how much restraint I need, depending on what we're doing, I will kind of, again, evolve for what we're doing and what my patient likes. If we were doing some sort of jugular venipuncture, Then I would want to put my fingers underneath his jaw like this, bring them to a point at the front of the chin here. I like to use my longest fingers, and part of that is so I can put my pointer fingers on top and kind of ease over the mouth so that I can tap, or I can keep him from opening his mouth too much. And then I've got my thumbs on the back of his head so that he can't back out. I've also got my palms kind of close together here, keeping him again from backing out, but also putting a little bit of pressure on his back so he doesn't feel like he can rise up and get out of the way. So again, that would be a jugular sternal venipuncture, tucking my fingers out of the way or letting them up here, whatever is easier for whoever is drawing for you. If we were doing a cephalic venipuncture, that would involve more of just one leg or the other. So in that case, I like to direct, again, squishy kitten, be patient with them. I like to direct their head over here. Again, I'm not pushing on that trachea. I'm just kind of holding on to the bones of the head to keep him over here, but also if for any reason he would decide that he wanted to bite, I can switch and hold almost like a neck brace here that prevents him from biting the person who is placing the catheter here or drawing blood. And as you can see, he's fighting it a little bit. I'm also kind of laying my forearm across his back so that he doesn't feel he can back out or move that way. Yeah, buddy. Yeah, I know. Good. And I usually let them up when they stop struggling, even if it's just for a millisecond, because you don't want them to think that if they struggle, they get loose every time. You don't want to reinforce that behavior, but you do want them to know as soon as they relax into it, that is a good thing. Of course, if the animal is becoming distressed to a point of self-harm, then let up on it because their safety is more important than the training moment at that time, okay? So as you can see, again, I'm holding on to his jaws here, top and bottom. I'm not pressing on that jugular or that trachea. I'm kind of cupping it, like with a C on the front, and I'm offering this up here, keeping the face and the head away from the person who's doing the procedure so that they're not getting bit. And then I like to kind of mess with their heads a little bit while that's happening so they can think about something else while that is happening, okay? So that is kind of our two ways of doing like a sternal restraint, and then we'll move into lateral. Okay, so for our lateral restraint, again, we have Luther here. Since we've already done a little bit of restraint, he's already a little bit over it. As we do with every animal, we have kind of a limited amount of time that our animals will tolerate being forced to do things that they don't love to do. So we're going to go ahead and try some sternal restraint. The biggest thing that I want you guys to focus on is that we need that head control. We need to keep feet away from the people who are doing the procedure and ourselves, and utilize your towel, right? Use it to cover up his head, or if he doesn't like that, to cover up his legs so that he can't use them to kick against you, okay? So on either side of the jaw, and if you just want to pet him and feel out, there's a little indent where the jaw, the mandible meets the maxillary. There's a little indent there at that jaw joint. And when you can feel that, you can place your fingers there. So usually what I like to do is put my thumb on one side, my longer finger, my middle finger on the other side, or my pointer finger if I need a strong grip. I know, buddy. But I like to save my pointer finger for tapping their head so I can distract. However, when you're first starting out, you may not have that dexterity, so you might need the full grip of your hand to be able to do this. I also like to put my hand over top of their head and smooth their ears down, and the reason I do that is because it allows me that leverage to be able to move their heads around as needed. As you can tell, Luther's getting a little irritated. He's starting to kind of flick his tail and vocalize a little bit, but he's still interacting. He's still feeling very curious and positive. He's just kind of like, what are we doing right now? So when I'm dealing with a sternal restraint for a kitten, again, that head control is paramount. A lot of things that I like to do when I'm laying a cat in sternal, is being able to control that head. So I'll start with that. I know. And a lot of times I might even just go for a cat collar around the back, and then I grab these back feet and lay him in sternal, okay? Again, I'm not touching on his trachea or anything like that, okay? Now, depending on what we're doing, we have a couple of options here. If we were working on the back feet, for example, I would cover up the front feet, head exposed or not, and then I have these back feet, and I need to work on controlling the head, wrapping him up really tight, and then controlling these back feet. And a lot of times with the back feet, want you guys to put a finger between the two of them so that they're not touching on each other too hard, okay? He seems to be not super fond of the around the jaw hold, so I'm doing kind of a loose cat collar for him. However, if I need to tighten that up and get a hold of his head, I'm pushing on either side of here. I know, and I have more control there in order to do more directing with his face, okay? And again, a cat bag may not be a bad idea for a little wiggly guy like him, but you can always wrap the towel much tighter around there. Now let's say we're doing something with his front feet, such as a nail trim, right? So again, not scruffing him, just holding on to like his collarbones and his neck. I'm gonna cover his back in here. I'm putting him against my body so that he feels that support, but also he doesn't feel like he can back out and run away. And then I would get this jaw here, and if I'm doing like a blood draw or something like that, I would stretch out this jaw here, and again, I'm hanging on to these points, these little indents here, and directing his head, okay? And then your jugular venipuncture would be done up here in the jugular furrow. Now, you can put a finger between these paws and pull them to stretch him out a little bit, or if we're doing a nail trim, a lot of times I will just offer up that hand and then keep a really good grip on this other loose paw. That way, he doesn't have the opportunity to scratch the person who is trying to do the nail trim. But either way, make sure that you're listening to your patient and you're watching them for cues of discomfort, struggling to breathe, or struggling to calm down at any point. If they just keep getting more and more anxious, you're going to have a harder and harder time remaining in control of the situation. So work with your patients, but also keep in mind that safety should always be put first, and that's everybody's safety. That's your safety, the patient's safety, and the safety of the person performing the actual procedure. So keep that kind of stuff in mind, and good luck with cat restraint.